everyone feel if I said I was going to start off today with an injection for everyone in here with this needle? What if you had to inject yourself with medication every day with this needle? My name is Victoria Stoneman, and today I will explain the two most common types of diabetes, type 1 and type 2, and some of the steps that diabetics must take to maintain their health. According to the American Diabetes Association, there are currently 30.3 million people in the United States with diabetes, and approximately 7.2 million people have diabetes and have not yet been diagnosed. With numbers this high, it's pretty safe to say everyone in this room either knows someone or will know someone with diabetes. Let's begin with talking about insulin and its role in your body, and then I'll explain type 1 and type 2 diabetes. Insulin is a hormone that comes from the pancreas. It circulates throughout the body to help the sugar move into the cells to produce energy. Moving on, type 1 diabetes is a condition in which the pancreas produces little or no insulin at all. This could result in sugar building up in your bloodstream and causing life-threatening complications. Type 1 diabetes is usually diagnosed in childhood, but can also develop in adulthood. According to the Mayo Clinic, the symptoms for type 1 diabetes are increased thirst, frequent urination, extreme hunger, irritability, fatigue and weakness, and blurry vision. Treatment for type 1 diabetes includes taking insulin, frequent blood sugar monitoring, eating healthy, regular exercise, and maintaining one's weight. Also carbohydrate, fat, and protein counting, which is not as easy as it sounds. Not everything comes labeled with how much carbohydrates, fat, and protein are in it. That brings us to type 2 diabetes. This is a condition that affects the way the body processes blood sugar. So in other words, the pancreas still makes insulin, but the cells cannot use it very efficiently. Again, according to the Mayo Clinic, the symptoms for type 2 are very similar to type 1. You have the increased thirst, frequent urination, the blurry vision, increased hunger. There are two symptoms that you will find in type 2 that you will not see in type 1 diabetes. This is frequent infections or slow to heal sores, and also areas of darkened skin, which could be a sign of insulin resistance. Some of the treatment for type 2 diabetes includes healthy eating, regular exercise, diabetic medication or insulin therapy, and also frequent blood sugar monitoring. Now that we understand what type 1 and type 2 diabetes are, it is important to remember treatment can help in diabetes, but there is no cure. In a book I recently read by Alan Rubin called Diabetes for Dummies, I learned diabetes can affect many parts of the body and is associated with serious complications such as heart disease, stroke, blindness, kidney failure, and even amputation. To wrap things up today, we learned about the two most common types of diabetes, type 1 and type 2. We also learned how it affects a large amount of our population. We need to be well informed so we can make smarter decisions on the food that we eat to prevent and maintain this disease. We need to eat more healthier foods such as bananas and plums, drink water as opposed to sugary foods and soda. Diabetes is the 7th leading cause of death in the United States. We need to make healthier choices.